My name is Nicole Asbury, and I'm a Bluefield State nursing student in the bachelor's program. And I am going to show you today how to insert a Foley catheter using Sterile technique, and I'm going to talk a little bit about Sterile technique and why it's important to our patients. It's important because we don't want to give our patients hospital-acquired infections, and they're also called nosocomial infections. Sterility means using practices and procedures that prevent contamination of pathogens. You are at a higher risk from getting an infection from a catheter if you are female gender, you have diabetes, you have diarrhea, if you're immunocompromised, and also if the catheter stays in for several days in a row, that increases your risk of infection. It's been reported that 70% of our patients who are admitted inpatient through the emergency room get a catheter, and that's a big deal because our patients come to us to get better and we don't want to give them more infections. It's also been reported that one urinary tract infection that is hospital acquired costs $8,000 for one patient, and if that urinary tract infection advances into urosepsis, then it costs up to $40,000 for that one patient. That is money that comes out of our budgets and our raises and our bonuses at the end of the year, so we want to keep those down. Also, it's not recommended to change catheters routinely. We only want to change catheters if they have an infection or there's an obstruction in the catheter that we can't undo, or if the closed system, like the catheter bag, is compromised. When you open a Foley catheter or any sterile field, you want to open furthest from you first, the furthest flap, and then the side flaps, and then the flap closest to you, so that way you're not reaching over your sterile field. When you open a sterile field, the outer 1-inch border is always clean. It's not considered sterile, so you can touch those edges with clean gloves, but not sterile gloves. When you get to your sterile gloves, you'll have betadine swabs or some kind of antiseptic in your catheter kit to scrub the area beforehand with. It'll also come with lubricant and a sterile container for a specimen if the doctor orders. So I'm going to show you how to put a catheter in a patient. But the first thing you do at the bedside when you walk into the room, if you're not familiar with that patient, is introduce yourself to the patient. The next thing you want to do is tell them what you're going to do. You don't want to go in and just start to yank their gown up and they not know what's going on. So you always tell the patient that, my name's Nicole and I'm going to put a catheter in for you. The doctor's ordered one, and we will leave it in for a little while, and when the doctor says that we can take it out, we will remove it right then for you. The next thing that we can do as healthcare providers to prevent infections is to wash our hands. We wash our hands for 30 seconds using soap and warm water, or we use an antibacterial approved hand scrub that the hospital has provided. So I'm going to wash my hands. For the sake of time, I'm just going to show a demonstration to make sure you get between your fingers and under your nails. Always keep down so the germs run down your hand. Put some gloves on to open our kit. My hands are still a little wet. And you also want to maintain the privacy of your patient by only exposing the least amount of the patient that's necessary. And you want to inform the patient of what you're about to do and things that you might have them do for you while we're inserting this catheter. Things like you may ask them to bear down so you can find the insertion site. I'm going to adjust your legs a little bit so that way we have better access to the site so we can see better. And I'm going to move the kit here between their legs. And I'm going to expose you just for a minute, long enough to put your catheter in, okay? Again, you always open, flap away from you first, and the 1-inch border around the outside is all that's clean. and then you want the last flap to be towards you. This is a clean drape for the patient, so there's no leakage or anything. Then I'm going to move my sterile gloves off the sterile field. And again, this is considered a sterile field, so the outer 1-inch border is considered clean. And I'm going to take these clean gloves off and put my sterile gloves on. You can only grab the cuff of sterile gloves because the inside of the cuff of sterile gloves. Then this hand is sterile, so you can grab any part of the glove that you'd like, but you can't touch anything else. Make sure once you're sterile, you only touch sterile fields. We're going to grab our drape and drape our patient for their privacy and again for cleanliness. While we're here, we're going to move our catheter around for convenience. We're going to open our betadine. And pour it onto our cotton swabs for cleaning our patient. This is our sterile cup, our lubricant. We want to squirt that in here so it's ready. And we no longer test the integrity of the balloon. The most recent guidelines say that that's no longer necessary because it actually weakens the balloon wall, and that's not something we want. If it would happen to break inside the patient, we then have to go for surgery to remove it. And I'm gonna, again, this is still sterile, and I'm gonna leave this in my sterile field. And I'm gonna tell the patient what I'm about to do. So I'm gonna grab your penis, and then I'm going to cleanse the head of it 3 times. And then I'm gonna insert the catheter, and you'll feel a little bit of pressure, okay? Once this hand has touched the patient, it's no longer sterile, and we cannot touch the sterile field any longer. So you grab a cotton swab that's got betadine on it, and you cleanse the patient, starting in the middle and moving out. And you only use 1 cotton ball per swab, and you perform the same technique with every swab. Okay, and then once we are ready for this, we're going to lube up our catheter. So you're going to feel a little bit of pressure, okay? Then you steadily insert the catheter until we receive urine from the patient. Then once we receive urine, we hold it steady so it doesn't pull out or go any further. Again, my right hand is still sterile. And we're just going to inflate the balloon. And pull back until the balloon is in the bladder, until it meets resistance. So that way we know that it's resting against the bladder wall. Things you don't want to do when you're sterile before you touch the patient is adjust your glasses or touch your face or any part of your body. You don't want to cough into your hand. You don't want to touch the patient or the bed rails with your sterile gloves. You don't want to lower your hands below your waist or the sterile field. You want to keep them above your waist in the sterile field. Those are all things that we do want to do, but that we don't want to do. The only things that we do want to do for sterile fields with our sterile gloves is keep our hands sterile. I hope that this helps prevent any nosocomial infections that we may have previously given our patients. And thank you for watching.